Good afternoon and welcome back to the Lynn Lowdown. I'm Dani Vittori, and today we have on two members from the Lynn Public Health Division. Thanks for joining us today.
Thanks for having us.
So would you mind just introducing yourselves and your respective titles?
My name is Candice McClory. I am the Substance Use Coordinator and Community Liaison.
And I'm Mulika Champigny. I'm the Community Resource Coordinator.
Great. So would you mind giving a brief overview of what the Public Health Department does, what your mission is?
So we kind of do a lot in the realm of health. We provide flu vaccines. We try to provide health resources, different health information. We have a public health coordinator who does food policies, and then we also have an epidemiologist and public health nurse who track infectious diseases.
Great. And you also have a community health resource room as well in City Hall that people can visit?
Yes, we do.
And what sort of services do you provide there?
So some of the stuff that we provide there, it's still new. It's about 1.5 years old now. We try to gather health information and resources from either local, state, or national organizations, and we try to provide those resources in our community health resource room. So when residents do come to City Hall, they're not just coming there to kind of pay tickets or get a birth certificate. They can come and get other resources that they wouldn't normally get at City Hall.
Great, that's fantastic. And one of those things is the Opioid Working Group, which is one thing you came on to talk about. Can you explain a little bit about what that is?
So the Opioid Working Group is responsible for making recommendations to the mayor's office in regards to the opioid abatement funds. The opioid abatement funds are the lawsuits from the Attorney General's office that were made to the pharmaceutical companies for their responsibility in the opioid epidemic. Mm-hmm. So the city of Lynn is getting a portion of those, and the Opioid Working Group offers recommendations on how to spend those based on a survey that we did in community engagement, so a lot of community feedback.
And the council itself is incredibly diverse, people with lived experience, healthcare, city council. Why is it so important to get so many different perspectives?
It's really important because not one person has the right answer. Right. So it's very important to show through the whole perspective of substance use, from youth to elderly to people that are actively using to people that are in recovery. So it's really important that we get the whole picture instead of just like one view and one perspective on what's going on.
And one of the reasons you came on here was for a notice of funding, that are funds that are going to be available to be distributed. Do you want to speak a little bit about that?
Yeah, so throughout the working group, we recently put out a notice of funding availability. So that is $250,000 that is open for organizations to apply to. And these funds are used for supplementing and strengthening services available in the area and people that are affected by substance use. Applicants can apply for one-time or recurring funds to support emerging innovative ideas to combat Lynn's opioid crisis.
And what kinds of programs or ideas would qualify for something like this?
So the good thing about this grant is we left it really broad, right, intentionally. We want people to get very creative and think outside the box. The point of these grants is to both bridge gaps in access to care and also build community within people that are actively using or in recovery. So and also we would like to fund things that aren't traditionally funded otherwise. So some ideas that could happen is organizations could get funds to pay for people to get their IDs. You can't go to shelter or detox without an ID, so that's essential to giving people access to care and resources. Gym memberships for people in recovery. Part of being in recovery is building community relationships and maintaining those. So building areas where people can connect, such as in the gym. Right. Along with that is alternative methods of treatment can also apply to this. So there's like Reiki, acupuncture, yoga, all those are ways that people have used to get themselves in recovery and building community. We can also do things like support for family or loved ones who have been incarcerated, support for loved ones who have lost someone to substance use, daycare support for new parents or in recovery or grandparents that are raising their grandchildren, scholarships for youth who have lost someone, support for someone in recovery or youth who have been affected by substance use, as in terms of like music lessons or art.
Yeah.
So things such as music and art, just to, like I said, build community and build up children, help them with youth prevention and ideas like that.
So yeah, like you said, very, very broad, really opens it up for people to get creative with ideas, which is a great thing. So
Yes.
maybe you can get some non-traditional ideas that can really help people.
Yeah.
And I'll circle this back to you for a second, Mulika, too. Another way you're doing this is with the public health van, literally
Yes.
going to people where they are at.
Yeah.
So how does that work?
So usually we try to bring the van to community events. So if any local organizations or community leaders are hosting an event where they're providing different health resources or just resources in general, they can always reach out to our department and request that we also attend the event, and we table there, we provide resources, different health information, and we kind of gear it towards the type of event. So if it's like a youth event, we try to provide youth resources, so like health coloring books, resources for parents with young kids, or if it's like an older adults event, we try to provide senior resources, so like disaster preparedness for seniors, or different organizations that can help seniors with healthcare.
And another thing you mentioned too is the way the van was decorated by raw art students. It quite literally looks like it's being wrapped by a mural. That was pretty cool.
Yeah, so the Raw Arts kids, we reached out to them last year to kind of see if they could come up with ideas to create a mural for our community health resource room. And the ideas, it was our previous nurses, Jen Almonte and MJ Duffy Alexander. The idea that they picked, the concept that they picked was kind of like health and togetherness. So when you look at the mural, you'll see like a woman kind of wrapping herself around. She's supposed to be kind of like Mother Nature. And then the sea aspect was kind of like to the old previous room had like a blue colored like ocean type theme. So it was to kind of pay homage to that. And our new public health director, Lisa Tobin, she really loved the idea of the mural, loved how it looked, loved how it brought the resource room together, and just really wanted it to be a symbol of public health. And so she decided to kind of put that on the van. So when people see us in the neighborhoods or within the community, they'll know that it's public health there.
Because it is. It's very recognizable. I've seen you at a few events, and I immediately know, oh, that's the public health.
Yeah.
Yes. And we want people to know that we're there with resources and information as well.
And you do so much through this working group, through the van, to really reach out and meet people where they're at. So what are you really hoping to show the community by making yourself so much more ingrained in it?
That we're here to support them, and that public health is really everyday life, and there's so many different aspects to public health, and really just reminding people what we do, because a lot of people are like, what does public health do? So just bringing it to them, like, we're here to bring you resources and support you in ways that may not have been traditionally available.
And I will circle back for a sec, because I realized I didn't ask, the funds that are available, how much funding is available, and what is the timeline for that application and use and such?
So the application deadline, we just extended. So if you go online right now, it does say the 19th, but we have extended it to October 31st. And you can access the application online on the Public Health tab on the City of Lynn webpage.
And then how much money is available, and if someone, let's say, received the grant, how long do they have to actually use it?
So there are $250,000 up in total for people to apply for. We do not have like a maximum amount that you can ask for. We may not be able to give people the amount that they do ask for, but we ask that you put the amount that you are looking for, and then we can, talk about it and see if it's if we're able to do that, or if there's like some leeway and we can, negotiate it a little bit.
Yeah, it sounds like really a program, really a thing. And are there any other qualifications in terms of applying for it?
Yes, so you have to be an established organization, so either a nonprofit or for-profit not-for-profit organization, or you have to be collaborating with one in order to apply. So unfortunately, no individuals can apply for, gift cards, but organizations can apply for gift cards for their participants.
Okay, I understand. So you have to work with some form of an organization.
Yes.
I'm trying to think, and I know we do have to wrap up in a moment, and I want to thank you both again so much for coming on to really share all the resources that the Public Health Division is providing.
Thank you.
Yeah, thank you.
Of course, thank you. Anytime. And once again, I'm Dani Vittori. This has been the Lynn Lowdown, and we'll see you next week with more guests.